Hello. When we have aches or injuries such as a bad back, it's usually advisable to move regularly, however tempting it might be to lie around or sit around. Okay, and I know this is easy to say. I mean, you're probably in pain, and there can be a worry they make things worse, but as long as you're sensible and not doing the heavy lifting kind of stuff, then some movements should actually help you recover quicker and feel better. So for the first part of this video, we're going to look at movements that you can do that are going to be spine sparing, and they're going to be gentle kind of things that don't provoke but start that stuff off. They're called micro breaks. Then we'll move on to tissue sparing things. So we're just going to try and correct some of the bad habits, movements that you might have been doing wrong that set this up in the first place. If we can take them out, then that's going to get you well on the road to recovery. These are the fundamental things really to do so you can start healing, and then you can move on to strengthening stuff. Okay. So the micro breaks, I'm going to move straight from one to the other. So the first one is my girl's ladder climb. For this, you just stand reasonably tall, reach up nice and high, and then movements like this, kind of like you're climbing a ladder, really. You do this for about 20 seconds, and then I'm going to move into another micro break, Brugger's relief. For Brugger's relief, you stand nice and tall. Have your hands hanging loosely by your side. What you're going to do though is make your fingers really wide apart. So loosely by your side, fingers really wide apart, going for it there. Turn your palms round so they're facing forwards. You should feel your shoulder blades come together, and then in this position just blow gently as though you're trying to make a candle flicker roughly about 1 meter in front of you. So wide. And so on like that. Okay, with the McGill's ladder climb, if that's too uncomfortable, if you're in so much pain there, then what you can do is take a nice deep breath in first and then do the reaching up. And also, these are micro breaks. They're good to get you moving when you're in pain, but they're also great things to do just to break up poor posture. If you've been sat for a long time, these are good things to get up and do, in which case I'd make the ladder climb much more of a reach and stretch. So really go up, try and get up as high as you can. Okay, that's the micro break. So what we'll do now is go on to some tissue sparing stuff based around the hip hinge. So tissue sparing is basically doing movements that spare achy tissues. They're movements that are sort of done mechanically properly. So moving things like the big joints of the hip rather than the little joints of the spine. These shouldn't be doing the heavy lifting. It should be these muscles and this doing it. So yeah, the hip hinge is the basis for a lot of tissue sparing movements that we will do. For demonstration purposes, I'm going to throw my arms out. And as an exercise, that's quite a good way of doing it. But if you note, my knees don't go in front of my toes, or they shouldn't do. My back is staying nice and arched. So if anything, I've got an exaggerated curve that way. So you can put your chest out a little bit, tuck in that way, and hinge down. Okay, as opposed to doing that. So again, if I do a hip hinge down, that's fine, and I'll often put my hands here to check that I'm doing this properly, and you can see if I start to lose it, my fingers would come apart, I'm losing that hip hinge. So yeah, hip hinge is the basis for a lot of tissue sparing, which I will demonstrate. Getting out of a chair can be awful when you've got back pain. Some sort of manoeuvre like this, and already we're not sparing the tissues. But if we think about the hip hinge, what we're going to do is move right to the edge of the seat. I'm going to try and get my feet as being as close to underneath my bottom as I can. So rather than starting out here, let's get a mechanical advantage of being underneath. I'm going to straighten up my spine now, get that hollow there. Maybe put my chest out slightly, and then I can just go straight up. I'm not bending my back, I'm sparing the tissues. That's it. Some people find it easier to do it with their legs more like this, and again, but as long as we're sparing these tissues, it's all about that hip hinge again, and that's how we could be getting down. And then the hip hinge is great for getting down to the ground. Let's break this down. If I want to weed that patch down there, for example, first of all we want to put a lunge in. So all the time I'm looking to keep my spine pretty straight. So I've gone down with a lunge, and then I'm hip hinging from here. If I want to go forward, and then back up, should be dead simple. The golfer's lift is another top tip if you want to pick things up off the floor. What we're basically doing a one-legged hip hinge, and you lean one leg out behind you. That helps you to keep your back straight. So if you watch professional golfers, this is how they tend to pick up their golf balls. So those sunglasses down there, what we'll do, let's go. Dead easy. I find it easiest myself to, the hand that I use for the picking up is on the same side as the leg I'm sticking out. Here I'm using the chair for support. You don't need to, or if you've got a stick and you're mobile, you could do that. They're pretty simple, aren't they, these micro breaks and the tissue sparing. There are loads of exercises that you can do for back pain, but they've usually got to be quite specific to what your problem is. You know, one person might have a serious disc injury, another person might have aches coming from a muscle or a little tear. So be wary of websites that give you exercises that promise to beat all back pain. It's often worth knowing actually what's going on with yourself first, and starting with the tissue sparing and the micro breaks is the first thing to get you on that step to the road to recovery. The other thing I want you to think about is we've shown you movements to do. Now start thinking about the things that you're doing at home or at work that may be aggravating this. You know, coming in the morning and doing that straight away to clean your teeth, you're immediately causing a problem. So if you can identify and start to eliminate these from your lifestyle, you'll help yourself recover and also stop setting yourself up for problems again and again. That's nearly the end. Just 2 quick points actually. With new injuries, I'd normally recommend you put ice on a newish injury. There is a place for heat, but generally speaking, new injuries, ice is going to get the heat down. So you want to get yourself a decent ice pack, put it on the area wrapped in a tea towel for about 10-15 minutes, and do that every hour regularly, several times a day. The other point is most repeat or ongoing back problems, they're usually a combination of a couple of things: an underlying cause that's stopping your body working quite as well as it should, and then the stresses that prey on that, like the bad posture, the bad moving that we've covered. So my day job in clinic is to look at those underlying causes. You know, very often you'll find something like a weak muscle or group of muscles that aren't protecting you when you do a movement for whatever reason. So if we can identify that as well and remove it, and you're working on these tissue sparing things, then that should be you improving and healing like bodies are supposed to do. So this, you know, back pain and problems and muscle pains and so on, they're not a normal thing. They're not something you should just accept. So yeah, give us a shout, come on in. Thank you very much for watching. I hope you found that useful. Take care. Bye bye.